So I'm Cindy, and I'm a UX designer at Summative Medical, which is a company based in Toronto. So I just have a brief synopsis. That's my Twitter, and then our marketing department's like, if anyone wants to tweet about it, then stuff. Okay, so I'm going to give a bit of context about what Summative is and what we do, and that will help inform the UX that I'm going to talk about later. So Summative was founded 5 years ago by 4 people, and they were all scientists and engineers, so it was very engineering based. And after 4 or 5 short years, we have 9 products in the market, 7 of which are medical devices, and we grew from 4 to 300 employees. So how the company was founded was this kind of problem. So this is a photo of brain surgery, neurosurgery. And what the surgeon using right now is a traditional microscope. And so you have this huge device in front of the surgeon. He's not always in the most ergonomic position. No one else can really see what he is doing unless it's projected onto a screen. But then there are scrub techs and nurses scrambling around him. It's a very different way of working than some of the other surgeries that we have all seen. And so the founders saw this problem and these unmet needs, and they wanted to improve upon that. So what their vision for the company was to build this integrated system to provide tools for using less invasive techniques and patient-specific approaches, and they also build all these tools to help visualize the surgery and communicate information transparently, and which can contribute to teamwork. And this would hopefully help improve patient outcome. And I guess I'll talk briefly about what's in this picture by using this slide. Next one. So what it starts with is, this is the usual surgical workflow too. So a bunch of techs would gather patient scans and data from Data Hub. So this is our image drive product. And then what they would do is import it into software, allowing doctors to plan the surgery. So that allows them to explore less invasive approaches for craniotomies and use cases with surgical corridors. Because what they would do traditionally is maybe take the shortest path if you had a tumor inside your brain and just cut through that. But then they might really touch upon a lot of tracks, neural tracks, that are pretty important to the patient, especially for speech, language, motor, and sight. So what this allows them to do is to avoid those critical areas and to maybe take a different approach to the tumor. And after they finish the plan, they would import it into a navigation system. And so this is our guide system. It has a little cart for people to manage the data and the scans and the plans, but they also have a big monitor for the surgeons to look at during the surgery to see where exactly in 3D space they are operating on. So it's kind of like a GPS for your brain surgery. And then after they have that, then this is our latest and greatest product, the Bright Matter Drive. Now it's going to be called Modus V. So it's basically a robot arm with a very advanced optics system at the end. And the arm would just follow the surgeon wherever he goes. And so he can keep his hands in the field. He can control it with a foot pedal. A surgical assistant can control it for him with the monitor. And we can't call it a robot because it doesn't do the surgery for you, but you can call it a robotic positioning system. And so the cloud up there is just the optics that goes into the arm. And it's pretty advanced. Like, we employ a lot of optical engineers to work on providing good quality images to the surgeon because it's what they see. So having given this context, I guess I'm going to talk a bit about safety critical UX and talk about doing UX for these kind of products. So what is safety critical? So a safety critical system is when your UX can actually affect the health and safety of users and patients. So that includes power plants, nuclear power plants, clinical systems, and we can think about aviation control, air traffic control, the UI in your fighter jet. Also, emergency response systems and like places dealing with hazardous materials, chemicals, and the military, of course. And so to prevent anyone from selling products and endangering the public in the medtech field, there are all these like regulatory governance bodies. People might have heard of the FDA, Health Canada, and the CE. So people know where the FDA governs? They actually, yeah, they only govern the US, but then they are kind of a standard for the world. There's Health Canada, and then there's CE. Do you guys know where it governs? So the CE marking actually governs the EU. And if you look underneath a lot of products you have at the home, you might find a little CE marking. And it stands for Compliance European or something. I can't pronounce that. And so some of these bodies make sure we follow all these standards and regulations. And here's a brief list of examples of the standards we do consult and follow. And the top one is like overall, if you ever wanted to develop a medical device from scratch, this is what you really, really, really need to know. And all the others below kind of follow it, but then they talk about specific things like human factors engineering, usability engineering, and risk management to your device. One interesting one is the HE75. If you're ever looking at graphic designs for designing a UI for your device, like that has a lot of specific information like contrast and font sizes and things to use. And so why is there such a huge emphasis on the human factors approach to design and development for the medical device? Is because what we usually have control over is the UI and the device. But then what we don't have control over is sometimes the user and the user environment. And that's what we have to consider a lot of times. And that's where following the previous standards come into play. So for us designers, sometimes it's good to refer to those standards to help us inform on best practices to avoid any use errors that might lead to unsafe or critical situations. So I have one small example here. So this comes up every day. I'm just designing a warning message. And I need an icon to go with my warning message to kind of give it like a bit more saliency. So you guys can guess which one I'm going to use. Anyone say the first one? Second one? Yeah? Third one? Fourth one? Maybe? Let's see. So actually, you guys are pretty right. So the second one is actually the general warning symbol, and all the other ones, the last three are actually from standards, and the first one is not from a standard. But then sometimes when you're using apps and other devices, you might see any of these non-standard symbols, and they kind of almost convey the same message, but it's still like slightly different. And it's best sometimes if you have this icon, you know that it's pretty general, and you want like something that's standardized and might be also accepted across cultures. You can go onto that little link, the ISO online browsing platform. Type in something like microphone. You might be surprised at what you can find. I went through like 3 designs of microphones before I'm like, okay, let's just follow the standard. Yeah. And so for designing for medical device UIs, we kind of follow a very typical user-centered design approach. This might be very familiar to most of you guys. It's like very cyclic, so you define your criteria, know your users and your business needs. You design things, and then using typical tools, and for us it happens in a very closely connected co-design process. I work closely with developers, engineers, and our users. Design, develop, and then we also validate our designs, test them. And some of the differences that we have in Medtech is we have a lot more like business and market needs. And also when we're validating, we also have to go through quality and regulatory submissions. And for us, our users are clinical, so it's an extra step of making sure we get all the surgeons, the doctors, the nurses, and the application specialists in to test our products. And after we get our field feedback, we might repeat the whole cycle again. So just to make things more concrete, so I'm just gonna quickly go through some examples of the UX tools we use. Like, you might not be surprised that we use a lot of the tools for a lot of other things when we're designing for non-Medtech devices. So for example, we use information architecture. This is something I did for the previous device. That's a OCT/Raman imaging device. So you take a little tissue sample, put it in, it gives you like metrics. And so they need a way to organize all their data, information architecture. This is our navigation system. What a lot of users have to do is very complex steps to register their patient, register their tools, and to know where they are in the navigation space. So we also do workflows for them, step by step, what you will see in the UI, what happens, what you do with your tool. Right now, they're tracing a little mask on the patient to register their contours in 3D space. And also, this is our the robot arm product, Modus V, I mentioned before. And so for some of these things, we might do wireframing. So this is evolution of a wireframe from the very, very beginning to the finished product. And when we're doing interfaces, we like to make things pretty too. So we might do different UI mockups and like explore different styles while adhering to a corporate brand. And last and the most important thing during the whole process is to always keep on testing our assumptions and testing our products. So in the healthcare world, there's two types of testing that we use called formative and summative testing. Formative testing is basically just testing your prototype throughout the design to help form it. So it could happen many times, and it happens when you have like smaller prototypes or you have like a bigger finished prototype. So it happens step by step, but do it often. And what we also do is a summative testing. So that's when you finish your device or your app and it's production ready. You take it to users and then you stress test it basically. Give them basic training and then unleash it on them and see if they pass or fail. And this is actually, like these two types of testing are required by the regulatory bodies, especially the summative testing. And so a good question to ask sometimes is like, how many users do I test? Can you guys guess? What is a good number of testing or the minimum requirement from the FDA? 2? Just me and you, right? So they actually have published this graph. So you can see it kind of tapers off as you go up to around like 15, 20, 30 users. And they do recommend testing for each user type you have. So for us, we have to find a number of surgeons, a number of nurses, a number of our support specialists, and anyone that might come across using the device. So what they usually recommend is 15 users. And so if you are testing your own app or product that maybe not be Medtech related, 15 might be a good data point to use. You get like, I think 97% of your use errors that way. And yeah, I think that's most of my presentation. I went faster today to make up time, but yeah. If you guys have any questions, I'm free to take them. Are there questions in this or no?
Yeah, you have 5 minutes.
5 minutes? Yeah. Yes?
What's UX an acronym for?
Oh, sorry. UX means user experience. So it's, you can also call it usability. It's a subset of human factors, but lately it's been mainly used for the software and apps world. Yes, Michael?
So is the 15 you suggested for the formative feedback stage or for the summative feedback stage? Only because if it's mission critical, with 15, there's still kind of a gap, problem spots.
Right. Yeah, you could go above 15, but then for us, there is a huge cost to finding even just 15. For us, our domain is in brain surgery. It's really, really hard to find 50 neurosurgeons that are willing to come and evaluate your product. So we had to divide our 15 users among like 3 or 4 different sites. But then for formative, the FDA recommends maybe even having 8 is enough. And it's up to you how many rounds of formative you want. And he actually recommends spacing it more in steps so you don't saturate or exhaust your user base. So you kind of keep like 3 or 4 for one time and then 3 or 4 when you have a evolution of your product. So yeah, I think that really helps. Yeah, Jody?
That was my question. How many iterations?
Yeah, for me, I like to see as many people as I can. So for clinical, it's harder to reach, like nurses, scrub techs, surgeons, they're all pretty busy. So if I can even get like 5 in each round for formative, that's pretty good. But I consistently do formative within the company. So I grab anyone I can find, engineers, product managers, program managers, and just kind of test your designs on them. Because they know the context, they know what you're designing for, and they are more informed than your users, they are maybe more trained than your users, but then like they're free and they are usually pretty happy to be involved in the design process. Mm-hmm. Yes?
Would you mind telling us what software you guys use for wireframing, or is that like proprietary?
Oh, it's not proprietary. We use whatever we can. Yeah, so when I started, I think one of our limitations was that we're a PC company because all our products were built for PC. But luckily our company believes in giving us as many tools as we can, so they got us the full Adobe suite. So in the beginning, I was wireframing a lot in Illustrator. But then later on, some people joined, and then they brought with them different tools from the outside. So I tried using something called Just in Mind for a while. It's also a prototyping tool, but the disadvantage of that is you have to rebuild your entire wireframe and prototype every time you update. And then at some point, halfway through, I'm starting to do high fidelity mockups. And I'm not going to recreate that in another software outside of Illustrator. So now we're moving on to InVision. And then our company finally gave us Max, so we're also using Sketch. Yeah. I'm keeping a list of things that are Sketch are better than Illustrator. It's pretty close right now, but yeah. I was pretty well trained by Michael. I really, really love Illustrator. Yeah. Anything else, or? Yes?
Are there other designers on your team, or do you primarily work with engineers initially?
So I was the first designer to join the company, so no one had any sense of UX when I first started. But then, since then, 2 more designers have joined, and it's still not a lot. There's 3 designers for a company of 300 people. But then there's other designers. There's industrial designers, and there's graphic designers for the marketing team. So we really try to leverage their visual aesthetics and their skills in visual communication. So we have design reviews. We invite all of these people, even if they're not on your project. Because industrial designers can bring a lot to your UX too. They are trained in human factors at school. And I find I learn a lot from them. Yeah. Okay. Thanks guys for coming out.